And as we do every Thursday morning right around this time, is we invite one of our health professionals from Maui Health to a talk story, and a special guest on the phone line this morning. We want to say happy birthday to Megan. Megan, happy birthday!
Thank you.
Megan, Kuikka, speech language pathologist, rehabilitation service, Maui Memorial Medical Center. Megan, I got a couple of questions for you this morning. For those who may not be familiar, what exactly does a speech language pathologist do, and who do they help?
So speech language pathologists, or we're also called speech therapists, we help people of all ages with communication disorders, stuttering, voice disorders, cognitive difficulties, or difficulty swallowing. Sometimes people ask why we work with people who have swallowing disorders, and the reason is because we have extensive education about the muscles in the head, neck, and throat. The same muscles we use to speak are the same muscles we use to chew and swallow. We work with patients recovering from strokes, brain injuries, Parkinson's disease, head and neck cancer, and other medical conditions that can affect speech or swallowing. We also help children who have speech delays, difficulty pronouncing sounds, kids who stutter, or kids who have difficulty eating and drinking. One of our biggest goals is to make communication accessible and achievable for everyone. And we support patients in both the hospital and in outpatient settings depending on their needs.
Got it. Megan, how do you work as part of a care team at the hospital?
So we work closely with doctors, nurses, and with the whole rehab team, and that's made up of physical therapists, occupational therapists, and speech therapists. And we also work with others to all come together and create a care plan that supports the whole patient. And then we help to track our patients' progress and then help plan their next steps in recovery. We provide a treatment plan to help people work on being able to eat and drink safely, especially patients who are at risk for aspiration. And that's where food and liquid can go into their lungs and potentially cause pneumonia.
Wow.
And then families are a big part of the care plan team, too. We coach them on how to support their loved ones' communication at home. And we also help with discharge planning, such as recommending continued therapy, or we have home safety tips for them as well.
Megan, why did you become a speech language pathologist, and would you recommend others look into it as a career?
I became an SLP because I really believe that people can recover from major health events. And I really love my job because I get to see patients get their lives back. I've gotten to see people speak to their family members again for the first time in months.
Wow.
I've gotten to see people eat their favorite foods again with their families. And yeah, I definitely recommend people consider it as a career. A lot of speech therapists are really willing to help people learn more about it. So reach out to one. We're more than happy to help. But I would say it is a big commitment. It's a master's program, so you'll be in school for a bit.
Speaking out of experience from the birthday girl.
Yeah, and if you want to learn more about our rehab services at the hospital, you can visit mauihealth.org/rehab.
Awesome. Megan, Kuikka, happy birthday, my girl. I'll talk with you again. Thanks for calling this morning, all right?
Thank you.